way.
Good morning, everyone. I am Kate DeBlanc. I'm a health and safety analyst for UCEAP, and this session is on our UCEAP health and safety course. We're going to discuss a little bit of the background of the course, how we developed it, what we chose to help with the information, and then I'll take you through some of the pieces of the course so you can get a sense of how it looks. Okay, so we are University of California Education Abroad Program, UCEAP. We work with 9 UC campuses to send students on 150 programs spread across 40 countries. We had just under 4,000 students participating in the 22-23 academic year, and we anticipate that the number of participants is going to continue to rise. So this map shows the area where students are, and a lot of students. So in communicating the breadth and depth of information that students need to know is a challenge. And especially when the information is boring. So as you well know, students have short attention spans and many things competing for that attention. Students often fail to recognize when they should, why they should pay attention to health and safety matters, or they don't start to really care until they're in the midst of an emergency. So likely they've never thought about health and safety in an international context before. We need to be able to communicate a ton of both general, across the board country information that can apply to every student no matter where they're going, as well as specific country city focused information. And we need to do this in a way that engages the student and captures their attention. So the first thing we did was we hired an instructional designer, Carrie Cap. She's going to be leading a session in the next hour on UCEAP's re-entry course. So if you like what you see in this session, check out her session and you can get a even deeper sense of her process and her work. So then we gave Carrie piles and piles of existing health and safety program materials. Here is an example of an old program guide. It's so long, it doesn't even fit on this slide properly. And here's an example of an online course that was in place at the time before I started at UCEAP. So we knew that we were going to be looking at these pieces of information to help us design this course. So Carrie would call this information gathering a needs analysis. So she gathers, analyzes the existing information, and that helps her plan for steering committees and other specialized teams and how she's going to plan out the project. We also gave her information on our incident reports. So the health and safety team tracks incidents that are reported to us, whether through students or staff abroad. And in analyzing that data, we can identify trends, and we can look at incidents that could have been prevented or made less severe if students were better informed. And that information is especially helpful for a pre-departure course such as this one. So I'll briefly go over some of our project goals. We were looking to empower students to become invested in their own health and safety, showing how they can make thoughtful, proactive decisions both before and during their program. We were looking to clarify roles, responsibilities, locations of resources, and other areas that have been predominant points of confusion for students. We made this course flexible and modular so that we could easily edit and add on, build onto it. Lastly, we wanted to decrease preventable incidents. So providing this course before departure means students will be better prepared, and we're hoping that in the long term, once we look at more of the data, we will see a decrease in preventable incidents abroad. So how was this course built? The course is standalone interactive learning experience. There's no faculty presence. Students don't get custom feedback. There's no synchronous interactions of any sort. It's authored in Articulate Storyline 360 software. And Articulate speaks with the learning management system Moodle. And the course communicates with Moodle to track learner completion and survey feedback. So there's a survey at the end of this course. And Moodle allows UCEAP to track narrative and Likert scale data. And we look at the responses, and that helps us continuously improve the information in the course and how it's delivered. Jira was used to track workflow. Adobe graphic, video, and audio software was used to create and adapt the graphic assets in the course. And lastly, Microsoft 365 was used for meetings, instant chats, document editing, document storage. We worked with over 70 collaborators. This includes staff, faculty, alumni, students, all within the UC system who knew our target demographics and our programs. They were our subject matter experts, script reviewers, editors, and beta testers. And for those of you who may be unfamiliar with the term of beta testing, this refers to when a real user tests the product before it goes live to look for bugs or other issues. So in this case, we had a group of UCEAP alumni and participants go through the course and give their feedback. We also worked with resource centers such as UCSB's Drug and Alcohol Program, the Resource Center for Gender and Sexual Diversity, and the Office of Diversity, Equity, and Inclusion. This is a simplified graphic to illustrate project workflow. We used an agile workflow specific to instructional or learning design project. And if you're interested in this, in Carrie's re-entry course, she goes into even more detail on this. So agile workflow builds in lots of prototyping, testing, and feedback, and this helps prevent unnecessary backtracking in the project. So in our preparation phase, we started with that needs analysis that I mentioned earlier. And then next we have iterative design and development design phases in which topics, formats, and timeline is determined. We work on the storyboard, we write the script, produce media, record audio, and start some beta testing. And based on that testing, we might have to loop back and fine tune some things to complete the project. And we add some accessibility compliance, and then the course can go live. So this is a timeline to give you an idea of how long this project took. We started the project in September of 2019. And this was to develop content that all students in all program locations would take. We called this phase 1, or the high level course. We moved our workflow online in March 2020, and then we ran our first beta tests for phase 1 later that summer. In September of 2020, we began development of the country-specific modules for programs with higher endemic disease. This is what we refer to as phase 2. So after applying some more beta test feedback, we launched the high-level course in October, and then the complete course went live in January of 2021. Since then, we've been tracking evaluation feedback, implementing fixes, and updates. So here are some of the design strategies we used. We wanted to establish a welcoming learning environment for everyone. We prioritized accessible features. We provided content through visuals, audio, reading, and writing. We're presenting topics through peer perspectives. We're integrating stories, games, and interactivity for engagement, of course, pacing. We're building scenarios based on, scenario-based decision assessments, and we're asking the student to reflect and analyze. And so the course topics flow in this way. We have 4 themed modules: Section 1, health; Section 2, wellness; Section 3, choices; and Section 4, norms. These are applicable to all students, all locations, takes about 40 to 60 minutes. This is phase 1, as I mentioned earlier. Then after that, students encounter a map. The pins represent the locations for higher health risk programs where there is that 5th country-specific module. So that is phase 2. If a student's country is not here, they are directly routed to the survey portion of the course. After students complete the country-specific module, they also go to the survey as well. So that finishes off the course, and there is a customized certificate of completion. I'll go over some of our course successes briefly. So our accessibility features, we have keyboard navigation. It's screen reader friendly. There's closed captioning, downloadable course transcript. Interactions are untimed, and they offer multiple tries with feedback. The course provides companion worksheets that can be saved or printed as notes. The course content supplements a wide range of UCAP and UC campus pre-departure materials. At the end of the course is a survey, and through the survey, students are commenting that the course doesn't seem too long or too short and that it's holding their interest. All students can log into our learning management system and access the course. Also, through the survey, students are consistently reporting an increased confidence and preparedness levels in knowing how to manage personal health and wellness. Also, increased knowledge of where to go if they need more information. Lastly, students are reporting feeling engaged in a number of course topics, such as cultural norms and using the student travel insurance. So here are those two primary outcomes of the course we've been tracking through the survey feedback. You can see percentage of course takers indicating more confidence in making health and safety decisions and indicating increased knowledge in accessing our health and safety resources. Next steps. A course like this is ever evolving, both in content and technical features, so we will continue to review and maintain it with edits and updates. We plan to update decision scenarios based on repeated student feedback in the surveys, as well as whenever things like country laws change or things are always changing, so we will always need to update. We're also looking to update the travel insurance section to reference our medical assistance partner. We have some mental health content updates planned as well. We plan to include information on a relatively new partnership we have with Lyra, a mental health service provider. And we have designs to develop a section on resilience, which would go over what resilience is and why students should know. We're also talking about bringing together a core group of our student health colleagues at different UC campuses to conduct annual reviews of health content, both in the main module and in the country-specific modules. Okay, now we get to the course walkthrough. And sprinkled throughout this walkthrough, I included some student quotes from our survey results. So where you can find this course, this link, learn.ucap.universityofcalifornia.edu, will set you to where the course is housed. There is a QR code for a sample of the course. So here you can try for yourself excerpts of the games, storytelling, interactivity, animation, and decision scenarios. So if you're interested in playing with it on your phone, you can scan that. I'll have that QR code at the end too. If you want to get to the course from our website, you would go to the menu button in the corner of our homepage. And that provides a drop-down. And then there's a sub-menu, Student Resources. I want to click on Health and Safety. And then towards the bottom of the Health and Safety page, we have Health and Safety Resources, and there is the Health and Safety course under the Health and Safety tab. So this brings us to UCAP Learn, and this is where we will house other online courses that UCAP develops. So you want to click on pre-departure, which is under the course categories to the right. And then UCAP Health and Safety course here, the gold arrow points. And if you haven't done this before, you use your campus ID and password to log in. It will produce what looks like a list of all the universities in the world. It's really long, probably not all of them, but scroll down to find University of California and select the one that you are at. And then here's some information for students. You can click the blue enter button at the bottom. So this is the first thing that students see, course orientation. Students will listen to a brief introduction. They'll see course objectives, they'll understand course expectations, and they'll take a quick quiz with at the end that'll check their preconceived ideas or assumptions. So I'll play a little bit of it to give you a sense. This part is not narrated. Here you can see we use click and reveal so that students can control the flow of information and proceed at their own pace. So there's a little bit of narration here.
The first 4 sections will take approximately 45 minutes to an hour. Each section has a scenario and so you can apply what you learned.
So that gives you an idea of the beginning. My other excerpts will not have audio. So towards the end of the orientation is the quiz. And this quiz is also in the sample that the QR code sends you to. So if you want to check it out there, you can play the whole thing. If you break a local law in the US Embassy, it can get you out of jail. Yes. What? US Embassy can't get you out of, darn. I guess I don't know as much as I thought I knew. Okay. So here we have section 1, health. I'll also point out that there's this menu on the left. There's also a glossary tab and a notes tab. So as you complete each section, there's a check mark to say that you've completed, and the locked portions are the ones that are yet to come. Section 1 topics include managing health conditions abroad, medications, disability accommodations request process, and student travel insurance. So in the course, there is some animation here. I'm just showing you a still. So this breaks down what could be a bit of an involved process into easy steps, and it demonstrates that students cannot arrive in their host country expecting all the accommodations they receive on their UC campus. This shows students need to start the process ahead of time, not when they arrive. Student quote, I liked that it had the insurance. Oh, I'm sorry. I think I went too fast. That's strange. Okay. It's this. So this is in our insurance slide. The student quote was not supposed to appear, but this shows you the different types of insurance that a student may have during their program, and it helps compare and show what could be a confusing topic for students, especially if they really haven't engaged with student insurance at all. They may not quite know what it means. So this student liked how it worked when they were overseas. Let's see. So this is a part of the course that shows after students finish a module. We want them to know the progress in the course and what they've completed and how much they have left to finish. So they always know where they will be as they go through the course. Okay, section 2, wellness. Topics include an overview of cultural transition, which is also called cultural shock, mental and emotional wellness, signs of distress, and when and how to reach out to program staff for help. Okay, this is a snippet from the cultural transition section. It walks students through the range of emotions they may feel at any time during their program. And again, it's click and reveal so they can go through each phase and control the flow of information. This one worked correctly. Student quote, I liked the description of culture shock as more of a transition that is difficult for everyone. It made the process less scary. I love this quote. I love the idea that we've been able to demystify part of study abroad for the student, and they feel like it's more approachable. Here is a snippet from managing mental health conditions. Students click on the icons to reveal the content. Again, they're able to control the piece of information. Section 3, choices. So the topics here are on food and water safety and alcohol and drugs abroad. The course stakeholder team worked with UC Student Health and UCSB campus resource centers on these topics. And we were trying to emphasize traveling internationally. So we're trying to distinguish this info from what students think they already know, whether it's through mandatory drug and alcohol trainings they've taken on their UC campus or whatever based in California. Here's a snippet from the smart food choices section. No matter how many times we might say, don't eat street food, students always end up eating street food and sometimes getting sick. So we took a slightly different approach. Now the sentiment is, okay, if you choose to eat street food, Look for these signs that indicate the food is well cooked to minimize your risk of getting sick. This is a snippet from the alcohol section. I like this activity because while much of the course is about the students managing their own health and safety, this part is more about how to recognize when others need help. So we're providing students with guidance on how to watch out for their friends. So here, I won't click on them. If you click on each profile, you will get a unique student perspective on alcohol abroad. These are stories that compare what I learned with what I experienced. And they are fun. So if you take the course, you can hear the student experiences through audio and student quote. I think the way alcohol is discussed is very effective. Other countries do not have rager party scenes. I enjoyed that the student used rager. They might, but at least the student is beginning to think of things more in an international context, and it's not just going to be what they know in California. This is one of our newer sections. We added this after the launch of the course. We're starting to see a rise in incident reporting involving cannabis. So we took a proactive approach by adding this section to communicate to students that laws and attitudes regarding cannabis abroad are not the same as in California. So here we direct them to talk with a counselor or a therapist. Another emerging trend is that students are deciding they want to detox from cannabis once they're already abroad, and that can cause problems. So we have plans to update this section with a note about detoxing well before leaving their program. Here's an example of how we link the course topic with existing program materials. In this case, the substance abuse policy that they can reference, we list what's in it and where they can find it. This, every section finished, every chapter, every section, yes, every module finishes with a scenario. So students read about details of a story, and then they use the knowledge that they've learned in the section, and they apply it in a game, or in this case, choosing the smartest choices out of the answers provided. And a student said that they liked that. It gave user scenarios to help solidify and imagine the context. So the student's able to put themselves in the scenarios. And section 4, this is the last section. Cultural norms and UCEAP emergency protocols are the primary topics here. Also covered here is transportation safety, laws, and penalties. So this interaction provides a starting place for students in order to research their host country. Topics like verbal communication, cultural perceptions of gender or race, social or political structures are highlighted in this activity. We direct students to verified sites to conduct the research, and we include a list of curated links in the resources tab, and I'll show you what that looks like towards the end. For this section on sexual violence and sexual harassment, we worked with the care director at UCSB. We wanted to make sure that the information we are providing is clear, accurate, and to the point. And the biggest takeaway we wanted students to know is that if they are faced with sexual violence, sexual harassment situation, they have options. And here we are linking the topic to the existing UCEAP policy, noting what's in it and where to find it. So that concludes the 4 modules. So then a student would click the go button and be taken to a map. And if their country is pinned, then it takes them to the 5th country-specific module. If it's not, then they would click here. Student quote, the map was dope. A student really liked this map. I think the map is dope too. And so here is the beginning of one of the 5th country-specific modules. I won't take you through it, but this gives you an idea of what topics are covered: health risks, endemic diseases, safety risks, and the importance of scheduling a visit at the travel health clinic. Well, I wasn't supposed to show like that. Survey question. So whether you go through a module that's country specific, or you just take the high level modules that we just went through, you go to a survey. And this student said, despite the subject matter being quite boring, the course was still engaging and made me more excited for my program. So for what we set out to do, it's very good. That's very good. It can be dense material, it can be boring, and yet despite that, this student was still inspired by the information they learned, and they're excited. Here is a certificate of completion. This generates at the end for every student. And let me show you the resources tab in the corner. So this has course worksheets and the course transcript. Also has any websites mentioned in the modules, such as Department of State Travel Resources, CDC, and World Air Quality Index. So when you select the worksheets, it opens them in a browser window so students can download and print. The first one is travel health. So it shows how to make a DIY health kit. We have emotional and mental wellness. Emergency preparedness. I like this scan the documents section. This reminds students to have these important documents in a secure cloud folder. And also this snap a photo. If they have these emergency numbers for their travel assistance and the 24/7 UCEAP number, if it's in their photo album, then they'll always have it on hand. Lastly, cultural norms. If you recall that activity with the colorful squares that was in a previous module, this is the worksheet for it, and it gives students, the framework for what they need to research for their host country in a worksheet form. Thank you for attending. Here is the QR code if you just wanted to scan that with your phone to check it out. And I will add one last student quote. I like how they made complex concepts easier to understand. That made me happy to read. Thank you so much. There's a couple minutes. I think there's a session starting exactly at 10. So time to hop over if you're going to that one.